Even before COVID-19, progress on increasing life expectancy was stalling, and the number of years we live free of disability was going backwards. The pandemic has shone a light on the huge health and wealth inequalities that exist in our society, but it did not create them, and it will likely make them much worse. Over 50s workers are on the brink of a long-term unemployment crisis. There are now over 600,000 people aged 50 and over claiming unemployment-related benefits, double the number there were in March when the pandemic hit. We risk millions of people struggling with long-term unemployment in the years before they are able to draw a pension, leading to a rise in pensioner poverty. Over 2 million people aged 55 and over are living in a home that endangers their health or well-being, and the poor state of these homes is putting many people at even greater risk of COVID-19. People in the poorest areas of England can expect to die younger and live longer in poor health than those in the richest areas. And it is the poorest older people who are amongst the most vulnerable to the virus. People on low incomes are most likely to be living with 3 or more long-term health conditions, which leave them more susceptible to COVID-19. They are also at greatest risk from the current delays in diagnosis and treatment of health conditions. The lockdown has seen more people helping out in their communities, with some people volunteering for the first time. But people in poor health and who are less wealthy face greater barriers to getting involved in their communities. They are also much less likely to have people they can count on for support or know where to access help. By 2040, 1 in 4 of us will be over 65. But those approaching later life face a future of less secure work, smaller pension pots, and growing inequalities in wealth and health. The current crisis has strengthened community feeling and is galvanizing public support for a new way of life post-pandemic. Unless action is taken, the gap between those who are able to enjoy later life and those who struggle will grow. Pensioner poverty will return. We need bold leaders to take action now, to create a world where we can all live healthier, happier, and more connected lives.